Thank you very much, Jerry. And once again, good morning, everyone, and welcome back to JC Now. And my guest this morning is Ken Woods, who is the president of Kansas Regenerative Medicine Center in Manhattan. It's an honor, Mr. Woods, to have you in studios this morning and talk about the Kansas Regenerative Medicine Center in Manhattan. You were involved from the very beginning with this company, and kind of tell us how this all got started.
Thank you, Mark. Well, initially, 3.5 years ago, myself and my business partner both had stem cell therapy, and we went to Beverly Hills, California to have the treatment. It worked so well for us, we felt like we should bring something like this to the Midwest.
That's interesting. That's a long way to go for stem cell therapy, and so you kind of figured that there's got to be a better way to do this, right?
Yes, we felt like most of our friends and family would never go to California to have a treatment like this, and we knew that there was great physicians here that could do the process, and we felt like if we could find those positions and put them on staff, that it would be a great thing for both us and our patients.
Let's talk about stem cell therapy, and I don't know if a lot of people really understand what that's all about and how beneficial it can be. It's been in the news, and probably falsely in the past. And let's talk about the stem cell therapy.
So there's many different kinds of stem cell therapy, but the therapy that we use is fat-derived stem cell therapy. And so basically, most of us have an excess amount of fat on our body, and so
unfortunately, I think that's the case.
We pull the fat, we process it down, and your fat is very rich in stem cells, and so we use that to treat your inflamed areas in your body, and it seems to be an extremely good way to treat, especially osteoarthritis and other areas like that.
That's what I was going to ask you. In what circumstances would stem cell therapy come into play? What would you use it for?
Well, I would say that most of our patients have osteoarthritis of some sort. There are other areas that it helps in. There's some autoimmune diseases that it helps with. But the primary focus is osteoarthritis or problems in the back as well.
Okay. How's the reception been since you've started the business, Kansas Regenerative Medicine Center, and you've got some partners that you work with, and how's that been going so far?
I would say that our reception has been wonderful. I mean, there's always some skeptics out there that feel like it's not a valid therapy, but our results have been exceptional. And most of the physicians, even if they don't understand it, when they're dealing with the physicians that we have in our company, they understand that these guys are top integrity type people, and they can't question the results.
Yeah, and you're talking from experience, so this is not just theory with you. This is something that you actually went through yourself. And tell us about your experience. Is it difficult to do? Is it painful? Is it something that's help people understand that a little bit?
I would say that my experience was we actually met a veterinarian that was doing the procedure in horses and dogs, and he had the procedure done on his own shoulder. I talked to him about my condition, and then as we met with the physician in California, I have osteoarthritis. I've had 5 knee surgeries. I was bone on bone in one knee, and they told me that there was a chance. It was probably a 70-30 chance that it would work for me. Mm-hmm. My results were amazing. I don't have pain anymore in my knees, which is what I was shooting for. The procedure itself is relatively painless. I mean, it's liposuction, which liposuction was the most painful part of the surgery, and then it's just an injection of your stem cells back into your knee.
What age group are we talking about here? Can you deal with patients of what age group? What
our target, probably our average patient age is about 65. Mm-hmm. We've treated people from as young as in their 20s to, I think maybe the oldest patient was around 90.
Okay. So it saved you having knee replacement or knee surgery, right?
Yeah, and it's sure. I mean, my goal was it should at least extend it because the technology gets better every year. And as we look at all the changes in technology that are coming in the next 5 years, if I could extend my knee life for another 5 to 10 years, then there'll be there'll be different things on the market that I maybe not have to have a full knee replacement at that point.
What kind of results have you been getting from your patients that you've been able to deal with here in this area?
The results from our network and nationwide are probably, depends on the condition and the severity, but we're averaging about 80%, 80 to 85% are seeing pain relief and are feeling better and feeling positive results. But we do have 10 to 15 that are not.
Probably with any kind of medication or procedure or whatever, that's probably the case in that situation. But that's interesting. So we need to get people to be thinking a little bit differently, maybe about pain control. Mm-hmm. Maybe is that right? And
that's the thing that our physicians will tell us is we can't. There's a lot of conditions we can't cure, but if you're not on your anti-inflammatory pain meds all the time, just the things like that help change your quality of life. That's been the things that have made our experience so much better, is to see people like that.
And I think that it's so easy in those situations to prescribe some kind of medicine or some kind of drug therapy to take care of that. And I've always thought that if you can avoid that, it with something else that might work as well. That's a good idea.
Yeah.
And so, what could you tell people that are thinking about that? How can they get in touch with you, and what's the procedure about getting with the Kansas Regenerative Medicine Center and getting something done?
So basically, the process starts with just a consultation. We have free consultations with our physicians. They get copies of your MRIs. They meet with you and decide whether you're a candidate. The process is not covered by insurance today, although that's something that we're working with insurance companies as we speak. We do allow for financing. We've developed a partnership with Bank of the Flint Hills. They finance procedures, but basically the process is come see Dr. Lyons or Dr. Pope for a consultation, and then see where it takes us from there. Okay. Once they schedule that, the procedure itself lasts about 4 hours, and the recovery time is very quick. You basically can walk out of the office, and we tell you to take it easy for a while, but you basically go right back to work.
Okay. I was going to say, is this a one-time procedure, or is it something that you come back and have multiple therapies on, or how does that work?
As a general rule, we've seen that it's a one-time process, but it depends on the condition. There's some conditions that will require multiple treatments, and as part of our network, we are working towards trying to find a way under FDA guidelines that we can cryobank stem cells and maybe allow for multiple treatments in the future.
Okay. So, Ken, tell me, when you had this procedure done in California, your thoughts going out there versus your thoughts after you got the procedure done, were you just inquisitive about it? Were you thinking, oh, well, it's worth a shot? And then what did you think once you got done?
Initially, I just thought, hey, if it's 60-40, I got to try something, because I'm not at the age I was at 40 years old. I wasn't at an age where I could have a knee replacement. Mm-hmm. But I was excited about it, but I was very skeptical. Mm-hmm. I was a small town kid going to Beverly Hills, California. I probably didn't fit in very well. But after the treatment and after the service that we were provided, and the things that I heard from other physicians within the office while I was there, I was super excited about the technology. And really within 30 days, I felt so much better that I just felt like it was where I was going to go. It was where the technology was going to go in the future.
So we can kind of heal ourselves a little bit with our own stem cells, right?
I think that God made us to heal ourselves over time, and we just through technology, we just have to find a way to get your stem cells to the areas that really need the intense healing.
Okay. For more information, how can people get in touch with you? If you got a website that people can go and take a look at more information on this?
Yes, our website is www.kansasrmc.com, and our phone number is 785-320-4700. And you can call and visit with myself, Ken Woods, or talk to our office manager, Kaylin Jacobson, and she would be the person to probably talk to up front. She's much smarter than I am.
Yeah. So if you got some pain, folks, it's worth a shot, and at least talk with the folks at Kansas Regenerative Medicine Center.
Yes.
All right. Ken Woods, thank you very much for stopping by this morning, visiting with us.
Thank you very much.
Appreciate you stopping in. Ken Woods, the president of Kansas Regenerative Medicine Center in Manhattan, on JC Now. Good morning.